Hi guys, I'm Claire. I'm a second year adult nursing student from the University of Southampton, and I'm here in my uni room, which I've never filmed in before, so it's really exciting. It's actually really late, but my boyfriend bought me this soft box lighting, so it's really cool. So today I'm going to talk about what to expect as a student nurse, which is really exciting for people who maybe are thinking about being a student nurse or going into nursing, or maybe first years who just want to know a bit more or things like that. So I'd say my first point would be the size of the cohort. So it's really quite scary when you're first coming in and you're like, there's so many people everywhere. There's over 400 in my cohort, which is actually a lot compared to, let's say, in school where there's like 120 in my year and things like that. So just knowing that it's a really big cohort, and that's okay, because just think everyone's in the same boat. Everyone came with not knowing many people, or even if they did know people, they still want to make new friends too. So just knowing that you're not alone and that it's okay to feel like a bit overwhelmed, but realize that it's not the end of the world and everyone has to deal with it, I think really helped me overcome the kind of shock and size of how big the cohort was. My second thing is basically just how interesting nursing is, which might sound like a strange one, but I just find it fascinating that we can study a module such as anatomy and physiology and learn so much about the body and how it works and what does it do, and then when you go into placement and somebody breaks their femur, you're like, I know what that is because I did A&P. I know what that is. So for people who are worried about the modules and stuff, because I was terrified about that, because I was my biology level wasn't the greatest going into nursing, which a lot of people probably had A's in biology, but I certainly didn't. So knowing that you can still learn so much and that's okay to not go in with loads of knowledge because you'll learn a lot was really good. And just knowing that what you're learning in lectures can be used in your placements. So knowing that, like what I said with A&P, and then you're if something happens to a patient, if they're going into an asthma attack or respiratory failure or something like that, you're that's what's happening to their body. It's just fascinating for me anyway. My third tip would be just how much learning you get out of placement. So people might think that you learn the majority of your content in lectures, but that's definitely not true for me anyway. I find that in lectures, yes, they're interesting, and yes, ones like A&P are crucial to being a good nurse, and ones like palliative care and end of life is really interesting to learn how to deal with people at their end of their life. It just crazy to me that you go into a placement, you get so stuck in that you're almost part of the furniture by the end, that you learn such a vast amount of information compared to lectures, because in lectures you have to go home and you have to do that learning yourself, while in placement, people say you learn by doing. That's so true, because in placement things just stick. You see something once and you just don't forget it. You're taught how to do a Clexane injection, or which is a blood thinner for people who are maybe prone to having blood clots. And then you see how to do that once and you don't have to be taught again. You know how to do that, which I found really cool. Also, placement is just a really good way of getting out of your comfort zone. I remember placement one just being terrified and being so scared to speak up or make friends with the nurses or be friendly with them or anything. And then by my last placement, I was nearly going to their Christmas party. It's just such a difference in your confidence. And all my mentors have said that your confidence improves over every placement. So realizing that what you're at placement one, you will not be like that by the end. So I went into placement one being how will I ever be a registered nurse? I'm too shy and things like that. But then by placement three, I was so confident and so outgoing with people around me, my patients, the patient's family, relatives. So don't be worried about that at all. Number 4 is realizing that you will not be friends with everyone. So this was a hard one for me to like realize, I guess, because I guess in school and stuff, I wouldn't like to have like people I didn't like or anything. I, like to be liked by everyone or just like to get on with everyone. But I feel like in uni it's a different story. Like there's just going to be people that you don't get on with, and that's okay not to get on with them, and just realize that you don't have to be friends with everyone. I feel like that's just part of kind of growing up, I guess. Realizing that you're not going to be best friends with everyone, and finding the people you do really like and sticking with them, and then just not worrying about the rest. Like there's no point dwelling on people that you don't get on with, because at the end of the day we're all different and we all like different people. So I guess that's important to remember when you're going into uni, that you don't have to be everyone's best friend, that it's really good to have people you like, and then the people you don't like so much or don't get on with as much, just to like not worry about them and not to dwell on it. Number 5 is that there's a huge range of assessment within nursing, like the nursing program. So in other programs, it's a lot of just exams in some, or maybe just assignments in others, or assignments and exams. But in nursing, we're lucky enough to have assignments, exams, placement, which is graded, and then also a thing called conversations, which I recently had one of them, which I'll be talking about in a future video, and I'll actually be doing a live reaction to my results, which is very scary and very nerve-wracking, but I just think it'll be really good to show like exactly what I got, because I did work really hard, so hopefully I did well, but if not, there's always next time, and I can always improve on what I did. So just to realize, I think in nursing that we're tested on like a range of different skills, so it's not just all like being really good at studying and being able to do exams. It's not all like your ability to write in academic writing and do assessments. And then placement obviously is really practical. So I just think the main message with this point is that even if you're not academic, oh, sorry, my phone just fell. Even if you're not academic, that you will like succeed, and that it's easy to do well, and that like you definitely will be able to. So just believe in yourself that you'll be able to do the different types of assessment. So number 6 is how friendly people are. So people that go into nursing tend to have similar personality traits. They tend to be outgoing, friendly, caring, loving, like things like that. So I find, although the cohort, like what I said in point number 1, although the cohort is huge, everyone is so friendly and everyone's willing to make friends and willing to get out of their comfort zone, I found anyway, with my cohort. So don't be worried about making friends, because everybody's in the same boat, like what I said. So people will be friendly and people will be approachable. So as long as you're receptacle to that, you will make friends, and people will approach you and be really friendly as well. So don't worry about people being like bitchy or not nice or anything, because I didn't find that at all with my cohort. Okay, so point number 7 is that mentors are so supportive if you use them right. So if you go to your mentor about things that you're having trouble with, they can actually do quite a lot to help you. So going to them about things is actually super important, and also going to university kind of support team or your personal academic tutor or things like that, because there's no point like suffering in silence or not telling anyone what you're going through, because the university is there to support you and they want you to do well. This is one thing in first year I don't think I knew as much as I do now. Like the uni's not trying to catch you out and not trying to fail you. Like they want you to do well. They want you to succeed, especially in nursing. Like it can be quite a difficult course in some respects, but nurses like want you to do well, and they've been in your shoes because most of them are nursing from background. So just going to them about things that maybe you don't feel comfortable enough to tell your friends or family or anything like that, and they can help you with maybe special consideration or change of circumstances or things like that. So I'd say, although it might be scary to go to like a stranger and an adult and be like, hey, I'm dealing with this, will take the weight off your shoulders and you'll get the help that you need. So that's one thing I found really useful and definitely have only come to terms with recently. So they're my 7 points on what to expect from nursing school. I hope anybody who's going into nursing school or thinking about joining nursing or becoming a student nurse, that maybe those gave you like an insight of what it's like. And I'll definitely be making more videos in the future about nursing school and what to expect, what to bring, and things like that. If you have any comments or want to talk to me personally and don't want to leave a comment, you can DM me on my Instagram, which I'll leave in the bio, and I'll reply to everybody. So just pop me a message there and I'm happy to respond to anyone about any queries you might have. Thanks for watching. Bye!